welcome everyone. I can see people starting to join today's session. Welcome to today's session about our adult nursing BSc programme here at Swansea University. I'm going to give it a couple more moments just to allow other people to join. We do have quite a few registrants for today's session, so I'm going to give it a couple more moments. I can see people continuing to join, and we will then go ahead and make a start. So I'm just going to allow people to carry on joining for the moment. So I think the numbers have roughly stabilized. So we're going to go ahead and make a start. Other people will be able to carry on joining the session as we go along. As you probably already noticed, we are recording the session, and don't worry, we will be sharing that recording with you after today's session. So you will get the chance to review this recording if you perhaps missed a part of it, or if you'd like to review the content, or if you haven't been able to join us live. So welcome everyone, whether you're able to join, whether you're watching this live or whether you're watching this as a recording. My name is Bethany. I'm the International Officer for the Faculty of Medicine, Health and Science here at Swansea University, and very pleased to be joined today by Jyoti, who is one of our admissions tutors, who's going to be sharing some information about our adult nursing programme here at Swansea. So I'm going to go ahead and start sharing my screen. And also just to make you aware, we are really keen for you to ask any and all questions that you have as we go along. So please do, as we go along, use the Q&A function at the bottom of your screen to ask any questions, and we'll get to those at the end of the presentation. So hopefully you're able to see my slides. For today's session, I've already introduced myself and Jyoti. We will hopefully also be joined shortly by Chris, who is a current international nursing student. And the aim of today's session is to give you a basic introduction to Swansea University and to the Faculty of Medicine, Health, Life Science, as well as a brief introduction of Swansea as a place to live as well, whether you are familiar with Swansea or not. And then I'm going to hand over to Jyoti, who's going to be speaking more specifically about the adult nursing programme in terms of the actual programme, the course structure, the clinical practice elements, the teaching assessment methods and the accreditation of the programme. I will then speak about the funding, the fees and scholarships, and we'll go across then to Chris, who's going to share their student experience. And of course, at the end, we're going to respond to any and all of your questions that you've put into the Q&A. So first of all, starting off with, where is Swansea University? As I mentioned, some of you may or may not be as familiar with where we are. We are based in southwest Wales. Some of you may be more familiar with London as a UK destination. So just to sort of put that perhaps into a bit of perspective for you, we are west of London, and we're about 3 hours via train from London. Swansea is the second largest city in Wales. I think the population is probably a bit over 250,000 now, but we are a nice close community. And the campuses, of course, both of our campuses, Singleton campus and Bay campus, are right on the seafront. And we are, in fact, the closest university to the beach in the world. And it is a beautiful part of the world, as we're right on the edge of the Gower Peninsula, which is the UK's first area of outstanding natural beauty. So it's not only a great place to live and to study in itself, but it's also a really good place in terms of location for exploring the rest of the UK. So it gives you that sort of opportunity to explore and make the most of your time whilst you're studying abroad with us. Just some stats I know that some people are very keen on finding out in terms of, how welcoming the city is going to be, how safe it is, particularly as an overseas student perhaps, and then the affordability. I know that's a really big question, concern as well, quite rightly so. So this is just to give you some statistics for you, that Swansea has been voted the most welcoming, friendly and trustworthy city in the UK. We are also a top 6 safe city in the UK, and we've also been voted the top 10 for most affordable university towns. So, that just gives you hopefully a little bit of reassurance, and that's been sort of that's independent rankings. But in terms of the level of investment and redevelopment that's been happening in recent years, it's been quite a lot in Swansea, which means that you'll benefit from that as students, because there is a lot of recreation facilities and activities for you to enjoy. We've got arenas, whether you're interested in entertainment like music or comedy, or sports, if you're interested in sports or interested in finding out a bit more about our local sports, then we are really well placed for that. More specifically about student life, we've got over 150 student societies, and I'm not really exaggerating by saying that there's pretty much a society for everything. So whatever your interest is, whatever your hobby is, it doesn't have to be anything to do with your program of interest, doesn't have to be to do with nursing, but anything that you're interested in, there is a likely society for that, and that's a really great way to network. Perhaps if you're coming from overseas and you're feeling a bit apprehensive about how you're going to make new friends, how you're going to network, then don't be worried. Student societies are a fantastic way to meet new people. And the campus locations, as I mentioned, we're right on the beach, as you can see that image of our students, and that is literally across the road from our Singleton Park campus, where you would predominantly be based as adult nursing students. And that just means that you get a really nice kind of work-life balance. It's just a really nice environment for you to live and study in. We also offer Discovery student volunteering opportunities, and Discovery is our university-based charity, and it gives students the opportunity to volunteer in Swansea and to perhaps gain some other skills and experience outside of your very busy adult nursing academic schedules. You also have the chance to apply to be a student ambassador. And I believe Chris is also one of our student ambassadors, and it means that you can actually work for the university. You do get paid for that, and you can sort of pick and choose however many hours you want to work, and you get involved in lots of different activities, from virtual activities like today's session, or also in-person events as well. So you might be meeting with prospective applicants, prospective parents who are coming to tour around the university as well. And this is just, I'm not going to go through all of this extensively, but it just gives you an idea of the kind of facilities that we have, particularly at Singleton Park campus. We are very close to Swansea city centre, so we're about a mile and a half, or perhaps just over from the city centre, where obviously there's a lot of amenities for you. But we do also have a lot of things available to you on campus as well. So you don't need to go that far if you don't really want to. Perhaps it's raining, or perhaps it's a weekend and you're feeling a bit tired. You just want to stay on campus. That's also very easily done. We've got canteens. We've got a little supermarket, so you can pick up some small groceries, as well as a doctor's surgery, a dentist. And of course, we've got our accommodation that's based on Singleton campus as well. In terms of the university accommodation, this particular image is from our Bay campus, but we do also have accommodation options on Singleton campus and Bay campus, and we do also have some accommodation options through partners in the city centre itself. We have a range of costs, and that sort of depends on what accommodation you might be looking for. So perhaps your preference is a twin room, an ensuite, a premium ensuite, but please do have a look at our accommodation website. They've got some fantastic virtual tours on the website, so you can familiarize yourself with the kind of accommodation that's available, and you can find which accommodation is your preference, what might suit your budget. So please do use the online facilities to familiarize yourself and find out what accommodation has to offer. As I mentioned, we've got two seafront campuses, which you can see here. So the top is our Singleton Park campus, and as I mentioned, as adult nursing students, this is predominantly where you would be based. And the bottom image is our newer Bay campus, which predominantly houses engineering and management. So the university itself was founded in 1920, And you see, we've got over 20,000 students, and I think these figures do need to be updated. I think we have more students, but we also have more international students than that. But that just gives you a minimum idea of how diverse and how broad our student cohort and our staff cohort is as well. And we're very pleased that for 2024 we've been ranked 307th in the QS World University Rankings, and that is from all institutions across the globe. So I believe there are at least 1,300 institutions involved in that ranking. So for us to be globally 307 is something that we are really, really proud of. Looking particularly at our Faculty of Medicine, Health and Life Science, the aim of the faculty, really, the hope is that we have a global reach and impact, and we've got that ambition to improve the health, well-being and wealth of society through our research, our education and innovation. As the name might suggest, we consist of 3 schools, which is the School of Health and Social Care, which adult nursing is part of. We also have a medical school and our School of Psychology. And the aim of the faculty is to draw together disciplines of public and allied health, nursing, social care, psychology, medicine, pharmacy, and obviously many more. And many of our courses, like our adult nursing programme, are accredited by professional bodies. Don't worry, I'm not going to go through all of these individually, but we are very proud of our faculty specific rankings. So we've got fantastic university wide rankings, but these are our rankings for our faculty specifically. So you can see we are 4th in the UK as a medical school, we are top 10 in the UK for nursing, 4th in the UK for health studies, 9th in the UK for anatomy and physiology. So there's lots of fantastic rankings that we have here. And again, just to quickly draw your attention to the fact that it's not just, we've got fantastic rankings in the UK, but we also have very strong rankings on a world stage as well, between the QS World University Rankings and our THE World University Rankings as well. Just to give you a flavour of some of our facilities, these images are just sort of snapshots of some of our facilities, but we do have a whole host more. We are very pleased to have a close partnership with our local health boards, and that means that we've got teaching facilities at both of the hospital sites. So the top left image you can see here, Singleton Park, Singleton Hospital, that is just on the very edge of our Singleton Park campus. So you can see we aren't just sort of close partnership, but we also are very physically close to the hospital. And we also have Morrison Hospital, which is another National Health Service hospital quite nearby as well. And you see, we've got anatomy suites and lab facilities as well. Something that we're very excited about, which is new, it is now open. At the time of writing the slides, we were hoping for it to be open in September, and it is now open. This is our new SUSIM Centre, which is our simulation-based learning, and it's a state-of-the-art simulation education facility. We've had a lot of investment in here to give students an immersive simulation centre that I think Jyoti, I'm sure, will tell you a bit more about this and how this will apply, how you'll be able to benefit as adult nursing students here at Swansea. So I'm now going to pass over now to Jyoti, who's going to go through a bit more specific information about the adult nursing BSc programme here.
Thank you very much, Bethany. So I'm Jyoti Shrestha. I'm one of the adult nurse lecturer, although we have 4 distinctive fields within the nursing program. We are at the moment taking on the adult field for international students. I will focus on this program, and I'll be able to give you any sort of clarification if you have anything later on. Can you move on to the next slide, please? Okay, so BSc Adult Nursing, we have 2 intake per year, September and March. So we literally finished taking March cohort, and we'll we'll be starting this September cohort literally in 2 weeks' time. And March cohort is the one which you might want to be applying for. We have approximately 180 to 200 adult nursing students per year in total, and that includes the in-house, like home students and the international students. Very recently, we have been very fortunate to get these 30 funded places from HIW and 20 self-funded places that we have within our university. Nursing often starts before most other courses. So for example, in September, maybe, they would start in the middle of September, but we would start a little bit earlier than the other courses. That's why students, if they sign up for a September cohort, then they would have to be physically on campus or within this Swansea within 2 weeks earlier than the course starts. And often March starts on the 13th or beginning of the second week of March. So ours is 13th of March for 2024 currently. Thank you. Just to give you a little bit of very basic information about how we run this course. The course structure is such that we use what we call a spiral curriculum, where we start, as you know, this is a 3-year program. So we kind of introduce a basic content in year 1, and we revisit the same content, same master's content in year 2, but then we develop further into that aspects of content, and furthermore in year 3. So say, for example, in year 1, they would learn something about very basic stuff, but as they reach year 3, we hope that they would be proficient on that particular content. So we have equal emphasis on theoretical and practical skills. As you would have noticed on our website as well, this course is divided into 2, so meaning 50%, which is 2,300 hours of required learning takes place on campus in Swansea University. And then what we say is a practical, meaning the placement. Students also learn in placements, practice placements as well. Because it is a professional program, a lot of learning also takes place in actually within the clinical environment. So when I say practical skills, is that skills that they have to develop also takes place in clinical placement. So I'll talk about this a little bit more later. So the way we divide the timings of 50% that college time or theoretical and 50% of placement throughout this 3 years within the program, it's not 50% all the way through, but the way we divide is year 1 and 2, predominantly they spend 60% of time in college, so learning different kind of theory, content, the different aspects of nursing, and the 40% of that time will be then spent in placement. But in year 3, they would have acquired all those required knowledge relevant to healthcare profession and healthcare related content that the student would need. That therefore in year 3, they would spend more time on placement, practice placement. So that would contain about 60% of total of that placement in year 3, total hours in year 3, and 40% in college. So all in all, the NMC, which is our governing body, required students to have spent 2,300 of learning in placement and 2,300 in theory on campus, basically. So that is how we actually divide this time. So it's never going to be 50-50 split all the way through in year 1, 2, and 3. But what we what we are trying to achieve is trying to actually meet the standards, educational standards set by the NMC. Without it, the students, once they become finish this qualification, they won't be able to qualify or won't be able to register on that NMC registration, basically. Next slide, please. So, like I said, we use a spiral curriculum in this program, and majority of other professional program use the same spiral curriculum. The structure of the course is such that we use what we call this blended learning approach. So there is not only the whole of the content is not only being delivered by face-to-face lecture in a lecture theatre, stand-up lectures, and they are the mixture of other methods that we use in teaching learning approach, such as a small group work. There will be a self-directed learning, because in this program, in this course particularly, as you know, they're all adults. So we do expect these adult nursing students to take some responsibility for their own learning. Not that we're going to throw them just out there giving no kind of instructions and scaffolding in their learning. We do give them the learning materials and the learning objectives that they need to achieve from that particular lessons, but they do it in their own time, although they would have allocated time to complete that particular learning content. They can do it in their own time and their own pace, and that's why we call it the self-paced learning approach as well. And also, there are multiple practical skill sessions, like you can see on the image here as well. We have a range of practical suites here within on campus, which is a simulated environment basically where they can come in and practice various skills. So that would be something from learning how to check somebody's blood pressure to learning how to put a cannula on their arm. But then these kind of different practical skills are divided into different levels of study. So say, for example, in year 1, they would be learning very mandatory, very fundamental skills, such as checking blood pressure, such as manual handling. Those are the mandatory skills they have to learn before they go out in a placement, just for the safety as well, so that they know exactly what they're doing. So we are not throwing them out in the placement, just having to practice on the patient, because ultimately the overall aim is the public safety of the patient or the service users. But how do we develop that? We do that, getting them to develop that confidence in here within different practical suites, and then they get to learn through practice, multiple practices. So it doesn't matter if they make a mistake, so they are safe to make that mistake. So they have that safety, psychologically they feel safe to be able to make mistake. So once they become proficient on that, competent on that, then they can go out on a practice to perform that particular skills basically. And also each student has a named personal tutor to support the academic study. So unlike any other program, they would have personal tutors, but then they would not necessarily have that contact every single module. Fortunately, our student in Swansea University in nursing program, they have personal tutor and they have designated contact time with them as well. So they feel supported throughout this program until they finish this program. Next slide, please. So clinical practice, you might be wondering what to expect in clinical practice. The image in front of you shows that the 2 students basically performing some kind of skills. It could be that they are performing something we say assessment of the patient in pairs, and they can learn what we call as peer learning. They can learn from each other. So they have a variety of scenario-based, problem-based learning opportunities as well as simulation. And the image Bethany showed earlier, where we recently, very, very recently, only a week ago, we have been very fortunate to open the door for everyone, every nurse, not only the nursing student, all of those professional bodies like paramedics or medics or ODPs, all can have similar equal opportunity to learn in that simulated environment. So it's a replication of hospital, maybe replication of community setting or the clinic. So basically, again, it's something slightly different to practical suites. Practical suite will be very much, working together, learning from each other and practicing that particular, those kind of psychomotor skills, what we call it. Whereas in a simulation center, it is replication of the hospital setting and the community setting, where minimal number of students, maybe 1 or 2 students, will be performing that simulation scenarios, and then they would have opportunity to debrief where the deeper learning take place, basically. So this simulation is very popular in nursing, not only in nursing, in healthcare professional programs, where majority of the deeper learning takes place. So there are a variety of equipments, and that the student can have opportunity to, if I put it in a simple term, play with, but that's how they learn. So there are other approach of learning that we use, not only stand-up lecture theatre learning, which can, that way students only learn very superficial. That is a superficial way of learning, basically. It is a full-time course, and when they are in practice, students do have to work full-time. So meaning, in UK, the standard working hours for a week is 37.5 hours. So students are expected to work 37.5 hours in clinical practice, with what we call is a practice supervisor, practice assessor, who are this registered nurses. So we have different fields of registered nurses, but the field of registered nurses will be the adult fields of registered nurses they will be working with. So they are constantly under supervision of that particular registered nurse, who we call is a named practice supervisor or practice assessors in a placement. Thank you. Again, further, a couple of things I've already covered earlier. So within that 2,300 hours that they are required to spend in the clinical placement, and that is required by the NMC, which is our governing body, to make sure that by that time they spend that amount of hours, they would have been proficient enough to go on that register in the NMC. So up to at least a minimum of 300 hours they would spend in simulation. So when we say simulation, that would include practicing skills in simulated environment, as well as simulation in the SUSIM building, where they would have the replication of that environment where the learning becomes deeper. And in that simulations, when they would be presented with maybe a very sick patient, and they would be asked to perform certain, maybe assess that patient and probably identify what the problem is and how they would deal with it. And then the facilitator would be one of the nursing lecturers, who would then pick out the different aspects of learning from that particular scenario, and then within the debrief it will be revisited, and that is how the learning becomes deeper. The placements for the students, they have opportunity to have a range of placement experience, and that would include something from accident and emergency to local prisons. You might think that local prison, what do you exactly learn from local prisons? But the amount of learning they come out of local prison is phenomenal, actually. They also have opportunity to have placement in nursing care home, so residential home. And I'm sure, later on, Chris, who's the first year student, international student, will have some stories to tell you about his experience as well. Next slide, please. So teaching and assessment methods, again, so some of them I've already covered earlier. It's not only the lecturing approach. We, in a big lecture theatre where Bethany is actually sitting right now, we have lots of seminars and workshops and one-to-one small group. There are interactive sessions, self-directed learning, like I said, study time. They also have their own study time, allocated study time when they are in theory block. So they have that theory and placement block. And they also have drop-in hours to learn specific skills. Maybe it doesn't happen every day, but there are specific allocated days in the month or the week where they can drop in to practice specific. Say, for example, I wanted to practice a little bit more on how to insert a catheter. So, but the opportunity I had, I wasn't very confident, so I would like to practice more. So they would have to come into that drop-in hours to practice a little bit more. In terms of the assessment, again, there are a range of approach of assessment. We don't only have essays, we have a poster presentation, oral presentations. There are OSCEs, which is objective structures clinical examinations. There are case studies. There are open book exams as well in second year. There are collaborative assessment as well, where up to 4 students will collaboratively prepare specific assignments and they would present it. So there are varieties of assessment approaches there as well. Thank you. In terms of the student support, like I said earlier, students are never left alone. You know, unlike other program, yes, you will have allocated lecturers or personal tutors, but you might see them maybe once in a year. But in a nursing program, the way we allocate specific contact time with the personal tutors, it's just, you know, that provides that support for the students, especially I would say for international student, not only international student, you know, fresh coming out of school, after A-level, just left parents' house, they might feel vulnerable, not confident who to talk to. So again, when we have allocated personal tutors, it's not only to support them for academic work, it's also, we also provide pastoral support. So when we say pastoral support, it's about if there is anything going on in their life, not necessarily they have to share with us, but anything that's going on in their life can potentially actually impact their learning when they are our Swansea University student, then personal tutor can support in a way. They might kind of signpost them to maybe well-being center or the disability, or it might be the matter that the student have some sort of disability, illness that they suffer with, and not knowing how to kind of manage that, and that could actually impact their learning. At that point, they can speak to the personal tutor, and they can actually support accordingly, you know. And on top of that, we have a range of other support systems, which are open to all students, not only international students. And then you can see on the slide, there are specific team who also support international students, such as International Development Office and International Campus Life as well. So they are very much specifically for international students. And like Bethany mentioned earlier, we have, you know, wide, big community of international students here coming from, you know, range of different countries from globally. And in terms of when you say Center for Academic Success, this is the team which, you know, there are specialists basically who can help the student in their academic writing or critical writing or researching, all sorts of referencing, because things might be slightly different in this country, especially the way learning happens, the way the teaching happens, and the way assessment happens in this country. So on top of the academic mentors or the personal tutors, there are tutors in academic success who can help you to kind of build that skills as well. Counseling, well-being centers, lots of it, there are a variety of support system there available for the students. Thank you. And again, I have already mentioned this. So the range of support within the academic writing you can have is something from presentation. So like I said earlier, one of the assignment is the approach of assessment is presentation. So you would have to prepare the poster presentation, say for example, but not very confident how to present. So then Center for Academic Success tutors can give you some tips about how to become a good presenter, how to present confidently, so that I can get as much, you know, better marks basically as much possible. so there are also one-to-one. So they don't have like a sessions on specific writing skills. However, saying that within the nursing, what we have done, the way we develop curriculum, the way we develop the modules, different modules, as you know, there are 3 modules each year. Every single modules, we have also included something related to the writing skills or the presentation skills that is relevant to that particular module's assignment. Then we have a talk and an hour or 2 hours talk from one of the tutors from academic success. So you will have that, but that is not going to be enough for the students. So they can contact the academic success tutors, make one-to-one appointment to spend half an hour to have that one-to-one support as well. And on top of that, they do run some master classes as well, and they do run some e-learning, and they run some classes as well, and they do have e-learning packages. Say for example, you couldn't make that day of session on academic writing, advanced academic writing, because they do it on a specific days in a specific time of the year. So say, for example, if you couldn't make it, then they can provide you e-learning self-paced packages, which you can then access it and learn it. As a Swansea University, it can't be accessed by anybody and everybody, but our Swansea University students can access those e-learning packages where they can do it in their own time and learn how to improve their academic writing. And again, because everybody learns things differently. I might be somebody who learns by listening to podcast or something like that, or I might be somebody who is a very visual person. So we all have different ways of learning. We all learn differently. We are all very different. So you only know what your learning needs are and what your learning styles are as a student. Then they can actually pick out the way they want to do it with the support of academic staff here and the tutors from academic success. So meaning what I'm trying to say here is there is a lot of approaches which are developed in diversity of learning in mind, basically. Thank you. Next. Okay, accreditation. So by this time, and when you are thinking about studying nursing or any other professional program, really, I'm sure you would do a bit of research around it. And basically, nursing is accredited by the registration is accredited by our Nursing and Midwifery Council. And they set the standards. So basically, if I take you down to the foundation level, how we developed curriculum, it was all based on what NMC set a standard as in. So when we develop this curriculum, we refer to the standard education standards and the standards for future nurses. So the way we develop the content for this curriculum, the nursing curriculum, bearing in mind that at the end of this program, they would have achieved what Nursing and Midwifery Council expect them to achieve. Otherwise, they wouldn't be able to register on that registration, NMC registration. So throughout these 3 years, the content within year 1, year 2, year 3, they would all be based on what NMC asked us to do. So basically, we are guided by them. Hence, our registration, the nurses registration, students registration is accredited by them. So after they complete this program in the 3 years program, we then send the details to NMC and successfully they can register on their registration. Yeah. Next slide, please. So entry requirement, BBB at A level. I'm sure you can access this information on website as well. There is a requirement, English requirement there as well. But again, as it says on the slide, it's very individual based. We do, once you submit your application, we decide case by case, although we have this minimum requirement of students achieving BBB in A level and IELTS 6.5, overall 6.5. But then there are different requirements. Say, for example, if you had achieved 90% and above in English in secondary school, you might not need to show that IELTS. So the requirement, you can show this requirement, achievement of this requirement in a different way. So we can also take other English equivalent to IELTS as well, English test. So it could be a TOEFL or it could be a SWELT. We do have SWELT, Swansea University English language test here as well. So any English test that is equivalent to IELTS 6.5, we can take it. So just please make sure that you make it very clear on your application. And it will be reviewed by panel, and once it is reviewed, the candidates will be invited for interview, and then often in interview panel there will be one of us, the admission tutor, because I'm an international admission tutor, and one of the other tutor or the service users or one of the clinicians from our placement as well. Thank you. So tips, basically, before you consider to apply, please make sure that you have fulfilled all the criteria I've just been through. And again, if you didn't quite catch it, either revisit our university website or the recording later on. So have the copies of all of your academic transcript, your predicted grades or personal statement, your academic references, and the evidence of your English language qualification. So don't forget, it's not only IELTS. We do consider equivalent IELTS to other English tests as well. Next slide, please. Personal statement tips, we do get asked about this as well. So when you write your personal statement, these are the questions you need to answer for. So basically what we are looking for is your motivation to write, your motivation to study nursing. Why did you choose adult nursing? Basically, there are thousands of different professional programs running. Why did you choose adult nursing? And that motivation has to come from you. What we want to do is we want to see just you, not what the students' relatives have said or students' parents have said, if that makes sense. It's the person who is applying to study. That's what we want to see. Why that person applied, why did they decide to even apply, even consider to study adult nursing, basically. And tell us about yourself, the student who is applying for it, and what could be your career aspiration. Be very honest and be yourself, basically, Thank you. Interview tips. Okay, so what we're looking for in interview, so if your application is considered and you are invited for interview, basically, again, similar kind of thing that you would have written on your, or the students, candidates' personal statement, motivation to study nursing. So through that, just show your understanding, the student, their understanding of what is caring, what is dignity. That is the key to the nursing, isn't it? And a little bit of familiarity to the service providers, such as National Health Services and NMC, Nursing Midwifery Council. In Swansea, we have Swansea Bay Health Board and Howlda. So have a little bit of, search around, explore around these areas as well. And it's easily available on Google. Google is the key these days, isn't it? It's the go-to for everything, really. And think about what's going on in the world in terms of the healthcare and the nursing. What's going on in there? What's the new development going on within the healthcare setting and healthcare as a whole? Just be natural, be yourself in the interview as well. It shouldn't be something that is not you, if that makes sense. Okay, just the way you prepare, it should come very naturally. because individuality is the key, isn't it? And we just basically want to see your personality, the student who come to the interview, your personality shine through in that moment. Next slide, please, if there is any more. Okay, if you are successful, you will be met by academic English language conditions. Of course, it is because it's a professional program again, safety comes. So it is always a conditional. So condition to occupational health, DBS, police check, and references as well. Next slide, please. Fees and funding, Bethany, over to you.
Yeah, so thank you very much, Dottie, for that. Hopefully that has given you a lot more understanding of our programme here at Swansea University. And not only that, but it's given you the desire to want to apply to us. So you're able to apply directly to us. You can access our apply through visiting our adult nursing course webpage, and you can make an application directly from our website. Now, as Jyoti mentioned, we do have some funding opportunities that are open courtesy of our Health Education and Improvement Wales. And just to give you a bit of information, so rather than saying all of that, we just say HEIW. And that's the designated body for education, training, development, and shaping of the healthcare workforce in Wales. So from this September, HEIW will commission eligible international students who wish to study nursing in Wales. And that is a project that's also got the approval of the Welsh Government. The opportunity is available to, again, eligible international students, which is something that I will discuss and I'll come on to very shortly. But the opportunity is available to those eligible international students who wish to study nursing in Wales, within the UK, so Wales specifically, and are also interested in working in Wales, again specifically for a minimum of 2 years following their successful graduation. And what does the funding mean? So if you are eligible, students will receive the bursary, which will cover the cost of the tuition fees for the 3 years of the adult nursing programme, and students will also receive £1,000 grant per year, which is divided into monthly payments, as well as a one-off £500 settling in grant, and that is only that's only given to students once they are fully enrolled in Swansea and they've got a UK bank account. Okay. So that just gives you an idea of what that funding entails. What's required from the student. Now, in terms of application, there is no different application process. So whether, for all of our applicants, it's that same application process, and following, if you are in a position to be offered a position, then we would check eligibility, and if you are eligible for funding, you would then receive a contract which outlines the terms and conditions of the specific bursary, and that would then be sent to you, and it would just be a case of you reviewing those terms and conditions, signing it if you are happy with those, and returning it to us. So those are, and obviously the key component is really the fact that you are happy and able to commit to a 2-year study of employment within a Welsh Health Board after you completed your studies. But don't worry even if you are eligible for funding, but if you feel that you are not able to, for whatever reason, commit to undertaking 2 years of employment in Wales after your studies, that's absolutely fine. You are still able then to be a self-funded student. And as I mentioned, please carefully consider if you can and you want to commit to working in Wales for those 2 years following successful completion of the course. Don't opt for the funding places if you're unsure, as you will be perhaps liable to repay that bursary. So really think carefully about what your desires are, what you want to do, even beyond your graduation, whether you want to stay in Wales where you're able to stay and work in Wales for those minimum 2 years. If students fail to take up the suitable employment on completion, then, as I mentioned, they might well be required to repay. So do think about that very carefully, and be mindful that that bursary, which I mentioned, does not cover costs to do repeat studies or any resits. So the bursary really is for those 3 years, with the assumption that you will pass on your first attempt, really. So if the course is extended beyond 3 years, for example, if you do need to resit, for example, the bursary would not provide any additional monies to the student to cover any additional costs. And important information with regards to funding is that Swansea University and HEIW abide by the Code of Practice for International Recruitment, which derives from the World Health Organization Global Principles for Ethical International Recruitment. So as a result of that, there are code of practice, some countries that we are not able to offer this funding to currently. So the current bursary policy states that students who are domiciled in what the list is red list cannot currently have access to these funded places. So all of the what we can do is that when we share the recording with you, we can give you the link to our international nursing webpage, and you can have a look at that and you can review. So please do have a look at the Code of Practice red list. If your country is listed on that red list, unfortunately, we're not currently able to offer you that funded opportunity. But of course, we would really welcome you to apply for the self-funded positions. So if you are not currently eligible to receive that funding, or if you feel that you would prefer to go down that self-funding route, for example, if you are not able to commit to working in Wales for 2 years afterwards, then you can look at the self-funded applicant options, and you can, oh, apologies, the lights have gone out. So the tuition fee then, if you wanted to go down the self-funded route, is £18,500 for March 2024. So that's for that tuition year. And it does have a rough and approximately 3% increase in each year. Students are able to apply for our International Excellence Scholarship, which is valued up to £6,000, which is deducted from your tuition fees. So students, you do need to apply for this, and successful applicants will receive an initial £4,000 deducted from their tuition fees in their first year. And then the students who achieve 70% or above in their first year of a study will then be eligible to receive a further £2,000 in their second year. So that would be £2,000 taken off your second year tuition fees. So please do. I've got the link at the bottom there for our international undergraduate scholarships, and you can keep an eye on those for the most up-to-date information, including any application deadlines. So now that I know that's a lot of information from myself and from Jotty, who's a tutor on the programme, which is all well and good, but I know very, very many of our potential and prospective applicants are very keen to hear from what current students think of the programme. So it's really important that we give you access to that. So thank you so much, Chris, I know it's busy. We do actually have a university open day at Swansea, hence why Jotty's in on campus. I, as just mentioned, am in a lecture theatre, and Chris is one of our student ambassadors and a current Year 1 international student as well of the nursing programme. So Chris is also on campus working as part of our in-person open day. But thanks so much for taking the time, Chris, out of your busy day to join us. So I'm now going to perhaps hand over to you to tell us a bit about your student experience of the programme.
Am I audible? Yep. Okay. So as Bethany said, my name is Chris Padico. I'm one of the international student nurses that started in March of this year. I am originally from India, but I came down from Doha, and I actually came down from Sussex because my parents also moved with me. But technically, I'm an international student, and I started out with the same sort of webinar and dreamt of coming to Swansea. I even dreamt of doing this job, and as you can see, I've reached there now, my goal. But I started out with the application as the tips have been given in the webinar. Stick on with those, even with interviews. What I wanted to say was, interviews are done online. So with your interview Zoom link, there will be sort of a snippet of everything that they might ask. So bullet points on what type of questions, and stick on with those, because those is very rare that they ask anything outside from those sort of bullet points until unless it's a very generalized topic that you should know. And for me, Jyoti was my interviewer and now my academic mentor, which is a personalized tutor who's a teaching faculty. So it might be a lecturer, it might be a professor, it might be a senior lecturer, would be allocated to you by the university centrally, and they will be taking care of you all along the 3 years. With in the middle of the second year, you would be having another mentor that will be separately taking care of your placements in order to avoid conflict of interest, because you're filling NMC paperwork. And then you've got multiple helps, as Jyoti said. You have your academic mentors, you've got module leads. So every year you've got 3 modules, and half of it would usually, in your first and second year, half of it would be theory and half of it will be placement. And that module will be headed by 1 or 2 people from the adult health department under the Department of Nursing. So you've got them, you've got the Center of Academic Success, you've got the Students' Union, anything to do with anything apart to do with academic work, there's always the union that you can go to. And as Jyoti said, experiences that you're going to gain from this particular course is one of its kind. We've got the new simulation lab, which my head of health and social care would vouch is second to nothing in Europe and even in the UK. So, and I know Jyoti's not, and Jyoti's module is predominantly done in that simulation center. So you will be actually simulated, so you would be in a mock setting, but very realistic from a virtual reality point of view. Like gaming, you would understand that terminology. And then those are actually moving and projected walls of wards and theatres within Swansea. So that can be Morriston Hospital, that can be Singleton Hospital, it can be the operation theatre of one of the hospitals that you might eventually go on a placement to. So it's a perfect grounding for starting out as a student nurse. And as I said, the experiences that you're going to gain, be it academic, be it clinical, be it your social life, is going to be great. We are one of the top 9 safest cities within the UK. And I can say that because I left my parents, even though they're in England, to Swansea. So I know how it feels when you leave your parents in entirely another corner of the world and you come here and you do, especially something like nursing, all alone. So you've got support. As I said, my journey have been terrific so it's been 6 months now this September, and I'm off to go for my second placement in cardiology at Morriston Hospital. So that will start on Monday, 7 a.m. So Bethany's laughing over the 7 a.m. Yeah. So those are things that you also need to consider about the course. You might have early wake-up calls. As Jyoti mentioned, it's a longer course. We start early, we have shorter breaks. We call them breaks and not vacations. So, but then it's a nice sort of, the curriculum and the academic calendar is framed in such a way that you're not overburdened. You'll have enough of breaks in between, not to mention at times more than enough when you compare classes with placement, because some of the classes that Jyoti has mentioned is self-directed. So the university considers you as independent learners. So you do the studying yourself for some of the bit. So those are all sort of small breaks. You can be in your home just with your laptop and do it in your own pace, in your own time. So yeah, and a final thing on placements, you're going to have the beautiful purple scrubs, as the slides have seen. Those are the all Wales scrubs. So nurses, whoever it might be across Wales, will be wearing those purple scrubs, and you will be going on variety of placements. The list that you have seen on the slide is just a small of an entire sort of encyclopedia of specialties that you're going to see. Wales is known for things that are specific to Wales. I was fortunate enough to go to ophthalmology in Singleton Hospital, which is right across the university compound. And in ophthalmology outpatient, they do something called cross-linking. So that's where problems with the cornea dealt with, and it's the only treatment that you can do in your cornea if the cornea has problems to it before a transplant can be. That's how you can avoid a transplant and do it in an outpatient setting. And that's only done in England and Wales. And in Wales, it's only done in Singleton Hospital. And I was fortunate enough, and they started to have student nurses from 2015 onwards. So I'm part of now the about 200 or 300 nurses student nurses who can now graduate to say that we are also trained to do cross-linking now, which before 2015 was not possible. So the opportunities are endless. You can go for teaching within your placement, which I'm looking forward to because I asked for one. And you can do anything that has some sort of relevance to nursing, which is everything. You can do informatics, you can do different highly specialized palliative care, neurology, etc. within your placement, and you have opportunity to have that sort of conversation with your personal tutor, your academic mentor, and put that through in your placement as spoke, as we say. So those are additional placements that you would do within your 6 to 12 week if you are in a third year placement, so that you get exposure of everything, your overall specialty that you're centrally allocated from the university, and things that have something to do with nursing as well. So looking forward to seeing you in the coming intake.
Fantastic. Thank you so much, Chris. I am conscious that we've reached time, but I think it's so important that we hear from Chris. And I've got a final question for Chris, actually, whilst we've got you online. What made you choose to Swansea?
Because it was less complicated to apply in the first place, I'll say. But the thing was, so I did have personal circumstances. I was originally slotted to go to another university, well, a couple of other universities in September. Then I had a personal problem, and then I switched to March. But then I did consider Swansea. Absolutely what nailed me was, so even after the interview, even if you pass the interview, you can drop out in the middle of it. That's opportunity anybody has got in the UK. So I was like, if the interview goes well, because I did pass other interviews in other universities, but I dreaded it. Absolutely, I dreaded it. So when I came to Swansea, even with the questioning in itself, I understood what they wanted to see. They didn't want me to, memorize the entire nursing handbook. What they wanted to know was compassion. What they wanted to know was my ethos. What they wanted to know was not only, because I was asked, I remember I'm slightly bitching about other universities, but I'm not going to name them. But then one of the universities asked me a very advanced clinical question, which I was like, if that's the sort of level that they're expecting, which they have, it's their own prerogative, then probably I won't be suited. But then Swansea asked me about basic stuff, highly generalized. You start from the low level and you build yourself up. That's what you need. And that university actually asked me about dorsogluteal injections, which I studied 2 weeks ago in Swansea. But then that's with universities. See, some universities expect a lot from you, some don't. Some knows where they need to start. Again, with Swansea, what you're gonna get is not everybody that came straight out of A-levels and schools. You're gonna get an exposure of millions of people from millions walks of life. You can have people that have come from other specialties within nursing, because we split our nursing, midwifery, adult, mental health, etc. And they want to do adult now. Or there will be people who are assisting nurses, called healthcare support workers or assistant practitioners. And now they want to top up their skills and become registered nurses. So those were the reasons. And of course, there's the beach at the park. Of course, nobody can say no to the park and the beach. Those in itself were, and then we are top 10 in nursing as always. So those all sort of accumulated, and those were the reasons why, especially the interview, because that's an opportunity you can have conversation with the lecturers. So be it any university that you're going to, always have that conversation during your interview. hopefully with the academies, usually there will be at least one academic in the panel. So use those.
Great. Thank you very much, Chris. So I'm looking now. I think we don't really have any outstanding questions. Hopefully the main thing that you are thinking now is how can I apply? So please do apply. You are able to apply directly through our apply system, through our course webpage. So go online. Please do think about submitting your application to us, and don't worry. You know, we are very open, as Jyoti mentioned. All of our applications are reviewed on a case-by-case basis. So, you know, if you aren't sure whether, you know, your perhaps academic or your personal background might not traditionally suit nursing, please do apply. We do really welcome all of those applications. So, you know, don't worry if you perhaps are, you know, perhaps a slightly older student to someone who is just coming from their A levels or equivalent. You know, it's about you as an individual, as Chris has mentioned, as Jyoti has mentioned. You know, it's about your motivation to nursing and your empathy, your compassion, dignity. All of those are really important ethoses which we champion at Swansea University. So please do think about applying to us. Contact us. I'm just going to go through to my last slide gives our email address. Please do contact. You can contact international.nursing@swansea.ac.uk if you have any questions. If you're watching this as a recording, if you'd like to ask any questions, or if you think of any other questions after watching this live, please do get in touch with us. So, Jyoti, have you got any other final comments or anything that you would like to say?
Not really, no. I did answer a couple of questions if you have noticed, and I think the second question I was going to do live, I think it's actually covered the way you said. There is no age restrictions. You know, whatever age you are in, or the students who is considering to apply nursing, you can apply to study nursing in this university. So there are lots of tips there. Please do visit university website, and you may have to go through, you know, different links to find out a little bit more about the program itself and the requirement, you know, what is required, so that you are fully prepared before you hit that apply button. Yeah. So yeah, good luck, everyone.
Great. Well, thank you so much to Chris for taking the time out of his busy student ambassador commitments for today. Thank you for joining us and sharing your student experience. And of course, thank you so much to Jyoti for also taking time out of the busy open day to come and share the program specific information about adult nursing. So thank you very much to everyone for taking the time to join us, either live or watching this as a recording. We really look forward to receiving your application and hope that we will soon be able to welcome you to Swansea. Thank you very much, everyone. Bye-bye.
Bye.